Hello everyone, I am Dr. Mahantesh Huli, ophthalmologist and Administrative Medical Officer, Taluk General Hospital, Bilgi. On November 12th, every year we celebrate World Pneumonia Day. The purpose of this celebration is to reduce the and to prevent the childhood pneumonia deaths and to create awareness among the public about the childhood pneumonia. Let's see what is this pneumonia. Pneumonia is an infection that inflames the air sacs that we call alveoli in one or both lungs. The air sacs may fill up with fluid or pus, causing symptoms such as cough, fever, chills, trouble breathing. The causative agents are bacteria and viruses in the air that humans breathe. This pneumonia is completely a preventable disease through proper vaccination. The vulnerable population for pneumonia are infants and young children, people older than age 65, and people with weak immune system. The prevalence rate among infants in India, under 5 mortality rate in the country is 37 per thousand live births, of which 5.3 deaths are caused due to pneumonia. What are the steps taken by India, the government of India, towards to prevent these childhood pneumonia deaths? The steps taken by India to prevent the childhood pneumonia deaths are: the government aims to achieve a target of reducing pneumonia deaths among the children to less than 3 per thousand live births by 2025. In 2014, India launched Integrated Action Plan for Prevention and Control of Pneumonia and Diarrhea to undertake collaborative efforts towards prevention of diarrhea and pneumonia related under 5 deaths. And the significant campaign the Ministry of Health and Family Welfare, Government of India launched in 16th November 2019. The campaign called SAANS. The aim is to reduce child mortality due to pneumonia, which contributes to around 15% deaths of children under the age of 5 annually. SAANS, SAANS stands for Social Awareness and Action to Neutralize Pneumonia Successfully. What are the key features of this SAANS campaign? To mobilize people to protect children from pneumonia and train health professionals and other stakeholders to provide prioritized treatment to control the disease. A child suffering from pneumonia will be treated with a pre-referral dose of antibiotic amoxicillin by ASHA workers in their village. Pulse oximeter, which is device to monitor oxygen saturation, will be used at health and wellness center for identification of low oxygen levels in the blood of child, and if required, the child can be treated by the use of oxygen cylinders. A mass awareness campaign will be launched about the effective solutions for pneumonia prevention, like breastfeeding, age appropriate complementary feeding, and immunization. The cardinal features of pneumonia, as we discussed earlier: cough and cold, difficulty in breathing, chest indrawing, and high fever. If you find any of these four cardinal signs and symptoms in your child, bring the child to the nearest government hospital and seek medical advice. Don't neglect these signs and symptoms. And this pneumonia can be prevented through the proper preventive measures. As soon as childbirth, within 1 hour, start the breastfeeding. Feed the exclusive breastfeeding for up to 6 months. Start the solid foods after the 6 months only. And the hygienic measures like keep drinking water covered, wash hands with soap while preparing food, before feeding the food, and after cleaning the house. Keep the child warm and properly covered. Do not let them walk barefoot. And ensure the timely vaccination from birth to 15 years of age. And in housing environment, keep the windows open and ensure smoke doesn't fill the house. Use LPG gas stoves for cooking to avoid the smoke. With these few measures, you can prevent your child suffering from pneumonia. Let's join the hands with SAANS and prevent your child from suffering from this deadly disease, pneumonia, and reduce the childhood pneumonia deaths. Thank you, everyone.